I frequently get asked about how reliable lactational amenorrhea method is for birth control. And so I wanted to talk a little bit about it. What lactational amenorrhea method is a system of birth control that can be only used in certain situations. So the requirements for being able to use this method are: one, you need to be in the first 6 months postpartum. So beyond that, it is not as effective. Number two, you need to be breastfeeding exclusively. So specifically feeding your baby at the breast on demand without bottles, without any sort of pumping. If you're pumping exclusively, that is wonderful, but it does not lead to efficacy of the lactational amenorrhea method. So exclusively nursing at the breast. And the other thing about that is specifically your baby must be eating at least every 4 hours during the day and no longer than a 6-hour stretch overnight without eating at the breast as well. So when we go over 6 hours, it's a wonderful thing when your baby sleeps a little bit longer, but you can no longer rely on this method of contraception. The other thing is that you must not have gotten your period back in order to follow this method. So if used appropriately and all of these factors are in place, then this method is 98% reliable. So that's not bad as far as methods go. It's better than condoms for sure. But because it is not as effective as some other methods, it is important to know that if you do not want to become pregnant for either medical reasons or personal reasons, but you really seriously do not want to take that risk of getting pregnant in those 6 months, then you should use another method, either along with lactational amenorrhea or instead of lactational amenorrhea. So this is not reliable enough to completely use in situations where you absolutely do not want to become pregnant. So something to remember. The other thing is that there are no barriers used, and so you need to understand that this is not going to protect you against sexually transmitted diseases, so it doesn't have that additional benefit. So that is lactational amenorrhea in a nutshell. Just to review, the things that are absolutely essential to use this and to have that 98% efficacy are: you must be in that first 6 months postpartum, you must be exclusively breastfeeding, nursing at the breast, and your baby must be eating at least every 4 hours during the day and not taking any longer than a 6-hour stretch at night. And then lastly, you cannot have gotten your period back. As soon as you get a period back, you cannot rely on this method anymore. So hopefully that's helpful. Physicians would be happy to discuss this further, but this is not a bad method to use if you want to save some money, and it's better for the environment for a lot of reasons. You don't have to worry about side effects of the hormonal therapies. There's a lot of ways that this can be beneficial, so it's certainly something to think about, but it's kind of a small number of people out there who truly fit into those criteria. So make sure that those criteria are met, and as soon as they are no longer met, then you must use another form of contraception. Hopefully this is helpful. Have a great day.